Hello, I'm Cynthia. This is Module 5, Discussion, Antibiotic Stewardship. The widespread and unwarranted use of antibiotics has led to drug-resistant strains of bacteria. Resistance is the ability of an organism to become unresponsive over time to the effects of antibiotics. The CDC has laid out some guidelines for preventing antimicrobial resistance in the healthcare setting. First is the prevention of infection. It's always best to try to prevent the infection instead of thinking of ways to treat it. That is done by ensuring that proper hygiene is used when delivering care of urinary catheters, PICC lines and central lines. Also, encouraging patients to receive their flu shots and pneumonia shots, and instructing them on proper hygiene in their self-care. Next would be the proper diagnosis and treatment of infections. That's culturing infections when possible and choosing the right antibiotic to treat the organism. Encouraging patients to take their antibiotic the full length of the therapy. The more prescription antibiotics that are given to patients, then there's the larger percent of resistant strains of organisms. Prevention of transmission of infection, especially in the healthcare setting. Nurses can contain infections by using proper infection control procedures. Patients should be taught the methods of proper hygiene to prevent transmission of infections. Also, to diagnose the infection properly, there have been a lot of instances, especially with my patients that go to the emergency room. Most every one of them is diagnosed with a urinary tract infection and given a prescription for antibiotics before a culture and sensitivity is returned. Usually when I pull these up to look at them, the cultures are no growth, or they were treated with the wrong antibiotic if they do have a UTI. Also, in the healthcare setting, we should make sure that the patient is getting the right antibiotic, the right dose, at the right time for the right duration. This reduces risk of drug resistance. It also saves the healthcare facility money. And saves the patient's money. So everyone in the healthcare facility should try to make it a goal to have antibiotic stewardship and develop a program and follow the protocols, and that is like the providers, the nurses, the doctors, also the hospital administrators. They always care about making money. Policymakers and also the patients should be a self-advocate on whether they need an antibiotic for their symptoms. And I work in a health department right now, and like I said, we have a lot of patients that are diagnosed with UTIs and treated with antibiotics. One a concerning event that happened last week with one of my maternity patients. She presented with some upper respiratory symptoms. She had no fever. She didn't have what I would consider signs and symptoms of an infection at that time. She requested an antibiotic. The doctor went ahead and prescribed her a Z-Pak and told her that if it was an infection, then this would take care of it in a few days. If it's not gone, then she probably has a virus and should have fluids and rest. That was quite concerning for that young woman. To me, she was happy that she got her antibiotic. And also, a few years ago, I worked in home health. I was an infusion nurse. I went into the home and educated the patient on how to self-infuse antibiotics in the home. Then I would come back and do assessments, obtain any labs that needed to be gotten for the physician to monitor their levels. This was really costly. Most of these patients were on the long-term antibiotic therapy in the home because they had a drug-resistant organism infection. So it is really important that we're having this education. I'm glad that we are, and I will certainly try to share my new knowledge with my coworkers in the healthcare setting. And this is the end of Module 5 discussion for me, and I look forward to hearing your feedback and listening to your discussions.